Here's another quiz. So what happens if you are bitten by an animal that tests positive for rabies or runs off and can't be found? Well, if you do nothing about it, as I mentioned, you're going to die. Otherwise, you could go through the post-exposure treatment, which you should. And the post-exposure treatment ends up costing the shelter more money because now you're throwing in more vaccines, the immunoglobulin injection also. About 40,000 people in the United States are treated post-exposurally, if that's a word, every year. Nobody, from research I could find, nobody has ever died from rabies who's taken the post-exposure vaccine. So that's great. So you're going to be cured and you don't have to worry about it. Remember, you could only develop rabies if you're bitten by an animal that has rabies while it's shedding the virus. So a couple of days before it's showing signs in a dog, cat, or ferret, or during that usually week or so period when it's showing signs of rabies, all the signs we spoke about earlier. So if you're bitten by an animal and a month later it develops rabies, you don't have to worry about that. But that's why you have the 10-day bite hold to give it that week to see and the extra few days to make sure it doesn't show signs of rabies in that time, meaning it was not shedding the virus in its saliva at that point. If you go on the New York State Department of Health website, you can find a protocol for who's entitled to get post-exposure vaccinations, what does an exposure mean, and what are the different variables to see if you supposedly qualify to get post-exposure vaccinated. Back to the story about Emma, that little kitten who had rabies in our shelter. So obviously the tech who was bitten and her boyfriend in the house certainly went for the post-exposure treatment. They live in a different county, actually a neighboring county, so it was done there. So our vet and the two techs who helped the vet euthanize the kitten wanted to go for the post-exposure treatments. They weren't sure if they got bit or scratched. We all have our scratches and bite wounds just from working with the animals anyway, any open wounds. They didn't know, was the kitten spitting on them, saliva going around, whatever. So they wanted to go for the vaccine. So the health department first said, no, you don't need the vaccines. You weren't bit or scratched. You can't say you were. So no, you don't have to go for them. So there was a big stink made. We investigated with the Erie County Health Department, some other health departments to see what was going on. The technicians called their doctors, and the doctor said, yeah, of course you have to get the vaccine. So finally, the health department acquiesced and said, okay, you could go for the vaccines. So they go for the vaccines, and not that the medical staff is up to date on rabies, they don't see it, they don't work with animals, the medical staff in the hospital, but they couldn't figure out what to do for the vet and the two techs. They wanted to give him the immunoglobulin injection. They wanted to give him the shots in the rear end where you're not supposed to get. You're supposed to get in the deltoid muscle. They wanted to do all kinds of things, and no one knew what to do. So fortunately, the staff, having some kind of knowledge, was able to explain to the medical staff at the hospital what needs to be done. So it could have turned into a big nightmare. As an aside to the story, how crazy medical healthcare could be, sometimes after a vaccine, the doctor or the nurse puts a Band-Aid on the area. So apparently the nurse opened up a Band-Aid, stuck it to her own arm, and then put it on one of the workers. So the moral of the story is you need to be informed, you need to monitor your own health care, whatever the case may be, and don't be so trusting that everyone knows what they're doing with that. So if you have been pre-exposed vaccinated, you only need 2 rabies vaccines after that, and you should be fine.